Coming to the composition, the lochia rubra, which consists of blood, shreds of fetal membrane, decidua, vernix eosa, laryngomeconium, these all things will be composed in the lochia rubra. Coming to the lochia serosa, which is less in RBC, more of leukocytes, wound exudate, mucus from the cervix, mucus from the microorganism, these all things will be there in the like lochia serosa. And lochia alba, there is plenty of decidual cells, leukocytes, mucus, microorganism, these all things will be there. Coming to the amount of lochia, like average it will be 5 to 6 days, like first 5 to 6 days 250 ml will be there, and normal duration it can extend up to 3 weeks also. So red lochia mainly it is seen like the first time the woman is getting up, like after long time the woman is getting up from the bed for the first time, the lochia will be more. And discharge, if the discharge is scanty during the premature labor, and in excess we can see lochia in the twins and hydromenosis. And clinical importance of lochia is like there will be abnormal puerperial state, then odor, offensive. If the odor is offensive, it indicates the infection. If amount is scanty or absent, it indicates the infection or lochiometra, and if it is excess, it indicates the infection. And color, if red beyond the limit, means we told that lochia rubra will be seen from the first to 4 days. If it is exceeds from the normal, like first to 4 days, it signifies the subinvolution. I told that subinvolution means the involution procedure is not taking place, the uterus is not coming back to the normal. So, or in this stage also you can see, subinvolution stage also you can see, otherwise retained bits of conceptus if it is there also, the color will be, the red rubra will be coming for more time. And like duration, if it is beyond 3 weeks, it means that there is a local genital lesion is there. Coming to the general physiological changes during the puerperium time. So, first one is pulse. Pulse will be raised soon after the delivery, the pulse will be raised for few hours, but after the by the end, like second day, it will become normal. And temperature, there will be 0.5 degree Fahrenheit rise during the delivery. Normal, it will be like within 12 hours it will come to normal, and third day again like slight rise in the temperature because of the breast engorgement. Coming to the urinary tract, the bladder will be edematous, hyperemia, the capacity will be increased, and common problems like overdistension, incomplete emptying, presence of residual urine, and UTI is also a main thing happening during the puerperium time, which is having a high risk also. Coming to the GIT, there will be increased thirst due to the fluid loss, and constipation will be there, delayed GI mobility will be there, weight loss will be there, and soon after the delivery, because of the expulsion of fetus, placenta, all the blood, there is chance of 5 to 6 kg reduction in the weight loss, and 2 kg during the puerperium time also. Fluid loss, first week there is a loss of 2 liter, and next 5 weeks there can 1.5 liter reduction will be there. And coming to the blood values, there will be slight decrease in the blood volume due to the blood loss and dehydration, and cardiac output, it will increase soon after the delivery, and which will come back to normal within a week. And RBC volume and hematocrit value, which will return to normal within by 8 weeks. And soon after the separation of the placenta, there will be leukocytosis, and placenta count will be decreases also, and fibrinojal level will remain high. And coming to the menstruation and ovulation, so onset of the first menstrual period, which is depends upon the lactation, and woman does not breastfeed, which can their menstruation can return by the 6th week in 40% people, and women who are breastfeeding by the 12th week, for 80% people 12th week the menstruation will be coming back. Coming to the ovulation, non-lactating mother, the ovulation will come back by the 4th week, and lactating mother by 10th week the ovulation will come back. And exclusively breastfeeding, which is a natural method of contraception, there is a 98% protection for 6 months from the lactation. And breastfeeding, what is happening? There will be increased prolactin level will be there. So which will cause the inhibits the ovarian response to follicle stimulating hormone. It will suppress the release of luteinizing hormone, and it will decrease the gonadotropin releasing hormone. So once it inhibits the ovarian response to follicular stimulating hormones, which will cause the less follicular growth, which will make like hypoestrogenic state, and which will cause no menstruation. Once the increased prolactin level which suppress the release of luteinizing hormone, no LS surge will be there, which will cause the anovulation also. So once the like increased frequency, intensity and duration of the suckling, which will leads to the high prolactin levels. So what happens, which will cause the prolonged ovarian suppression and lactational amenorrhea will be there. And coming to the lactation, this is also an important thing during the puerperium time. So here like a healthy mother which can produce 500 to 800 ml of milk per day, and which requires around 700 calorie per day for that, for the production. So you know that like there is a store of 5 kg fat during the pregnancy. The pregnancy whatever we are gaining, in that the fat 5 kg like the glucose is stored as a glycogen in the body for like fat, and this is used during the lactation time. So first 2 days there is no anatomic changes in the breast will be there, and secretion of the colostrum will be there. Colostrum is nothing but it is a deep yellowish serous fluid which is alkaline in reaction, which is having high specific gravity, which is having high protein, vitamin A, sodium and chloride, which is low carbohydrate, fat and potassium, which when we compare with the breast milk, and which contains the antibody IgA, IgG, IgM and humoral factors like lactoferrin also. So because of presence of IgA, IgG, IgM and humoral factors like lactoferrin, which will act as a immunological defense to the baby. So here we can see the comparison of colostrum and breast milk. So you can see that the protein content in the colostrum is 8.6%, breast milk it is 1.2%, and fat content in colostrum is 2.3% and breast milk is 3.2%, and carbohydrate the colostrum content is 3.2% and breast milk is 7.5%, and water content in colostrum is 86% and breast milk is 87%. And coming to the advantages of lactation, as I told before that antibodies IgG, IgM, IgA and humoral factors like lactoferrin, which gives immunological defense to the baby, and laxative action also for the baby, because the fat globules are large in size. So because of the laxative action will be there. Coming to the physiology of lactation, so we know that the lactation starts from the delivery, but preparation for a effective lactation it is starting from the pregnancy only. So we can divide the lactation into 4 stages. So first one is mammogenesis. So here it is nothing but preparation of the breast for the effective lactation, and synthesis and secretion from the breast alveoli it is lactogenesis, and ejection of milk is known as galactokinesis, and maintenance of the lactation it is known as galactopoiesis. So coming to the mammogenesis, so which is happening during the pregnancy only, we are preparing the breast for a effective lactation. So here what happens, remarkable growth of both ductal and lobulo-alveolar systems also. So lactogenesis it is nothing but it is synthesis and secretion of milk from the breast alveoli. So prolactin and glucocorticoids, these are the 2 important hormones which is acting in this stage. And here during the pregnancy the circulating levels of glucocorticoids, estrogen and progesterone will be high. So which will leads to the inactivation of the prolactin. But after the delivery what happens, estrogen, progesterone, glucocorticoids level will reduce, so that what happen, it will activate the prolactin, and which will leads to the synthesis and secretion of the milk. Coming to the 3rd stage of lactation, it is nothing but it is galactokinesis. So here the stage of ejection of milk. So here mainly oxytocin is like major hormone which is there for the ejection of the milk. So during suckling the conditional reflex it will set up, and it will known as the milk ejection reflex or milk let down reflex. So the milk ejection reflex, it will inhibit by pain or breast engorgement or adverse psychic conditions also. Coming to the fourth stage of the lactation, it is nothing but it is galactopoiesis. So here the prolactin is the most important hormone for the maintenance of the effective and continuous lactation. So suckling is also essential for this stage for the release of the prolactin. Thank you. And the next part, like management of the puerperium, that in next class I will be taking. Thank you.